So that was something that really kind of intrigued me, because we witnessed him having this conversation, and he was quite adamant that his sister had been there with his mother and his grandmother as well. So that was a really interesting case there.
So here we have a scenario of information that has been picked up by somebody that doesn't have that information. Now, in the ordinary world that we live in, we don't get information that way. We get information from people telling us, we read about things and everything else. So when you have circumstances like that, you have a case where somebody has perceived something that it is impossible to know. And I'm very much just, as an aside here, I'd like to just mention a case that I became involved with. Penny and I have a mutual friend called Graham Nichols. And Graham trains people in out-of-the-body experiences, which is a similar kind of phenomenon to the fact of when somebody has a near-death experience. And Graham was training a group of individuals on a training course back in 1999. And while he was training them, he started to feel very, very peculiar. And he fell to his knees. And the next thing, as he described to me, he said he found himself in a jungle. And he could feel the heat and everything else around him. And he walked through the jungle and he stepped out into a corner in Soho. Literally, he said he walked out and suddenly he was standing in a three-dimensional reality. Because he said somebody ran past him and he felt the wind as the person ran past him. It was that real. He then looked down the street, I think it was Brewer Street, and he looked down the street, and as he did so, he saw an explosion take place on the north side of Brewer Street. People started crawling out, covered in blood and everything else. He then hears a voice in the distance calling him, saying, "Graham, Graham." And it was the people in the lecture theatre calling him. And he said he found himself come out of that body situation and found himself coming to. When he came to, he immediately turned around to everybody and said, "I've just witnessed an event. There's going to be a terrorist attack in London soon." People witnessed this from what he said. I've actually spoken to some of the individuals involved, and I know some of the individuals who were involved. 5 days later, there was the bombing of the Admiral Duncan pub. 5 days later, in exactly the location that Graham perceived there. So here we have a precognitive out-of-the-body experience, which suggests that when we go into these altered states of consciousness, we are not only outside of space, we're also outside of time in some way. Now, many of Penny's cases are very similar to this, and it's the question of exactly when we have these experiences, are they just hallucinations? Now, from a medical point of view, what's your opinion on the idea of the general consensual argument for materialist reductionists is they're hallucinations? You hear it time and time again. So from your point of view, do you feel that they're hallucinations?
Well, that's one thing that I looked at with my research. In intensive care, you do get patients who hallucinate quite a lot, you know. They have very clearly observable behaviour. Sometimes they try and get out of bed. Sometimes they try and remove the tubes that they've got in them. They can become aggressive to the nurses. And they're very random often, the kind of things that they are, and sometimes paranoia as well as to what the nurses are doing to them. So what I did is I compared the cases of near-death experiences with the patients who'd actually been hallucinating. And I did find that there were differences. So the people who'd had the near-death experience followed a particular pattern. They were very uniquely kind of individual experiences, but they did follow that theme. Whereas with the hallucinations, they were very random, they were very bizarre. And when I investigated the hallucinations in depth, it was all attributable to the background noise and the conversations that they could hear. And it was kind of like some people who'd been hallucinating. One lady in particular, she said, "I was convinced that I was dead and that I was on the Swansea to Cork ferry." Now, if you sit on the beds that we used to have, they've got these air mattresses. If you lie on one, you feel like you're on a bed because it sways you from side to side. And at the time that she was recovering from sedation, she was being looked after by a nurse with a very thick Irish accent. So there were all these kind of background cues which kind of would lead to make that conclusion. Whereas when I followed up people then who had been hallucinating, a lot of them were really embarrassed because sometimes they had sort of inappropriate behaviour. Some of them didn't remember anything at all. And the ones who did remember could rationalise that they had been hallucinating. Whereas the people who'd had the near-death experience were adamant that this was a real experience. And one man in particular said, unless you've experienced it yourself, there's no way you could possibly understand it. And the interesting thing about patient 11, he had a near-death experience. And during his experience, he went into this other realm and he met up with a dead relative. And that relative sent him back to life. And she said, you've got to go back, you're the head of the family. But when you go back, I want you to give this message to one of his living relatives, his daughter. So when he revived, he gave this message to his daughter, and she was absolutely astounded that he should know this information. It was something that she'd gone to great lengths to keep a secret from him. Yet he knew this information, and he gained that during a time when he was deeply unconscious. Now, how do we explain that? He got information that he wasn't previously aware of. So I think cases like that really then make me think, what is consciousness?
It does. It brings us into the real area of exactly what consciousness is, because we work under the assumption that my brain just creates consciousness magically. It's what is known as the hard problem of consciousness. And the Australian philosopher David Chalmers has called this the hard problem of science. Because effectively we can all turn around and argue how things are created in the external world, but everything around us is physical. So are physical chairs and everything else, and there's chemicals around us, and there's atoms, and there's electrons and quarks and everything else. But your brain is made of physical material. It's made effectively of electrical impulses and neurochemicals. And the interactions between those neurochemicals, the electrical impulses, and the neurons in your brain create the sensation of being you. The three-dimensional being that lives in your head. That being that has hopes and fears, gets excited about things, has memories, and yet there is nowhere in the brain they've been able to actually find the location of consciousness. They can see evidence of consciousness affecting the brain, because effectively you can do MRI scans, you can do fMRI scans, you can do CAT scans, PET scans, various scannings you can do of the brain, where you will ask somebody to think about something and certain parts of the brain will light up. But that's confusing the map from the territory. Just because parts of your brain are lighting up because certain things are being thought doesn't necessarily suggest that consciousness is within the brain. Because I would argue if you took the back off an old valve radio, you would see the lights appearing in the back of the valve radio. Those lights, you could conclude, was evidence that inside the radio is an orchestra that's playing Bartók's violin concerto. But of course the orchestra is not located within the radio. The orchestra is located either in a time in space, where they're in a studio, it's like the Maida Vale studios and it's coming out that way, or it's located on a recording that has been made many, many years before. So there's very much the danger of confusing the two, because modern science has no idea how this inanimate material can create self-referential consciousness. Mm-hmm. Now, there are certain philosophers, such as Daniel Dennett, will argue that it's an illusion. We are fooling ourselves into thinking we're conscious, which is crazy, isn't it? Because every single person in this room knows that you are a conscious entity that has a backstory, you have motivations, thoughts, and feelings. So consciousness, I think that near-death experiences are one of the classic examples of that liminal interface place between life and death, because we assume that after death, that's it. There is no more of you, you cease to exist. But there is strong evidence to say that you do continue in one shape or form. Now, the thing is, with near-death experiences, these are classic examples of this. And there are other cases that you've touched upon, Penny, I know in the book, that particularly intrigued me. Which ones are the ones that you think were your favourites in terms of
Well, an interesting case,
intangibles?
something that has really fascinated me is a lady that I met in a conference in 2013 in France, in Marseille. This lady's name is Raja Benamor, and she's Moroccan. And she had a near-death experience, and she was in hospital. She went in for an operation. As soon as they injected the anaesthetic, she suddenly felt herself out of her body, and then she had a really very deep near-death experience. And she felt that she existed at a very tiny quantum level, and that she travelled around her body, around all parts of her body at this quantum level. She also had a life review back to her own birth, but also back to the birth of the universe. But the interesting thing about her case is that she, as a result of her experience, suddenly became fascinated with quantum physics. And she found that she had a very in-depth understanding and knowledge of quantum physics. And she'd never studied it before. She'd only had the basic grade teaching in school. And this was so powerful for her that she decided that she would go to university and enroll on a course in order to study it at more length. And the interesting thing in this conference for me was that they'd interviewed her university professor. And he said that I don't understand how this lady could have acquired such knowledge, because this isn't something that you could gain just through reading books or doing a booster course. This is very deep-seated knowledge. And in fact, some of the things that she was writing about in her papers, he said it's beyond my level of knowledge. But he said what she has written about has since been confirmed by other publications in physics journals. And so how do we understand that in-depth knowledge when someone is deeply unconscious? So their brain is not functioning as it would do normally. So there's something happening in the brain which is allowing her to tap into some sort of information that she wasn't previously aware of. So when you hear cases like that, it really kind of reinforces to me how important it is that we understand the experience as well.
Well, of course, the materialist reductionists will argue that it's brought about by hypoxia, that's lack of oxygen in the brain. So effectively, if you don't have any oxygen in your brain, the brain ceases to function, and therefore you start to go into hallucinatory states. Also, there's too much carbon dioxide within the brain itself. And these are the standard explanations. What's your response to those?
Well, I looked at those with my research as well, and there were some cases, I analysed the blood results of the patients when they were having the experiences. It was very difficult to pinpoint exactly sometimes when the blood had been extracted, so there were only a few cases of this. But one man in particular that I can recall had an out-of-body experience, and he used to have these quite spontaneously, and we didn't realise what was happening to him. He'd have periods where he would just all of a sudden become blank, and he would stare ahead, just vacantly stare, and you'd go like that in front of his eyes and he wouldn't flicker at all. And it happened with me, and after a while he came round from it. Now this happened a few days later with a young nurse who'd just started, and she was very concerned. As soon as this happened, she called the doctor and extracted some blood from his arterial line. She analysed the blood results were absolutely normal, but when he came out of this state, he reported that he was up above her, up near the ceiling, looking down on the back of her uniform. And the blood results were absolutely normal. So there's a case there of someone who wasn't hypoxic, but clearly having this experience. If you look at people who'd had the cardiac arrest, in my study, there were 18% of people who'd survived cardiac arrest. So there were another 82% of people who hadn't reported the experience, but they were all hypoxic. So if it was due to the lack of oxygen, more people should have had that near-death experience, not just 18%. So I think it's important to look at possible causes for the experience, but the ones that we've got at the moment, I think, need to be revised a little bit and expanded upon.
That's a very interesting point, isn't it? The idea that there is, if the near-death experience was a universal, effectively most people would have it. Now, there could be a counter-argument to say, but some people don't come back from death, because as you say in the book, the closer you get to death, it seems the more likely it is that a near-death experience will take place.
Yes.
So we are talking literally about near-death experiences. Now, in my first book, Is There Life After Death, I discuss the idea of real death experiences, RDEs, where individuals don't come back to tell us what happened. But as they've got closer and closer to that point of no return, are we just seeing glimpses through the door of what really takes place?
That's it, and I think that's all that we can do at this point, you know, with these experiences, because they are literally near-death experiences. After death, we don't know. We won't know what really happens until we experience it in our entirety at our own death. So, you know, that is a really good point. But I think it's important that we do understand that these experiences can happen as we approach death, because that can really impact on how we care for people who are dying as well. So I think that's a really important aspect.
Well, it's one of the major arguments that's used again by the critics who will turn around and say, well, they are to a certain extent culturally biased. Now, I know there's been work done by Dr. Ornella Corazza at SOAR and the work that she's done with Japanese near-death experiences. I've worked closely with a guy called Dr. Mahendra Pereira, who's dealt with near-death experiences in the Sinhalese community. And effectively, there are great similarities between the experiences. Obviously, there are certain cultural biases that you will inevitably have, but I don't necessarily argue that that is proof of confabulation or wishful thinking. What I believe is happening here is that the brain is preparing somebody for moving over. So what it will do is it will collect information from various areas to actually ease the passing almost. You know, the thing is that it's the idea, but then we come on to the idea, well, is it endorphins? You know, the drugs that the body can generate itself to make you feel at ease, to stop pain. But self-evidently from your case, I know you go through in the book quite systematically all the areas of excuses. No, excuse is the wrong term, I shouldn't use the term excuses, but explanations for it. I mean, like ketamine is something that is very, very popularly cited. And there was a paper written about 1979, I think, by a guy whose name has escaped me, Carl Janssen. And Carl Janssen wrote a paper about ketamine. And they argue that because ketamine can simulate near-death experiences, therefore it proves that a near-death experience is an hallucination. But let's think about this for a second. Just because a mind-altering drug can create the same sensation doesn't invalidate the sensation. It means it can be reproduced, because in my work I argue that, yes, it is an hallucination. It is brain generated in the sense that the chemicals in your brain facilitate your ability to communicate with altered states of consciousness, which is not the same as saying it is an hallucination. And I've always argued to people, when you turn around to people and they say, and it's the blanket excuse, isn't it? You'll find it time and time again, they'll say, oh, it was an hallucination. The next question you should ask is, okay then, explain what an hallucination is. Then you will get all kinds of wishy-washy, well, I'm not really sure. Because if they have to explain hallucinations, they have to also be able to explain self-referential consciousness in the brain. And they can't explain that. So therefore, who is the person doing the witnessing of the hallucinations in the first place? So for me, these are all elements of the same experience. Now, one of the major areas I'd like to touch upon now, which Penny will be able to talk about, is the Moody traits. There are certain typologies that Raymond Moody described that make up a classical near-death experience. And I'd just like us to chat a little bit about them now.
Yeah, well, what Raymond Moody found when with his first book, Life After Life, he spoke to about 150 people who'd had a near-death experience, and he realised that there was a set of components that were really quite common to most of these cases. So the experience could start with the out-of-body experience. It could they may hear a bystander saying, oh, then they've died or they've had a cardiac arrest. The person may then go through a dark tunnel or a transition from darkness into light. And this light is usually very, very bright, but it doesn't hurt the eyes of the person. And very often they feel very magnetically drawn towards this light. And when they get into the light, they find themselves in a different realm. And sometimes there's beautiful gardens with lush green grass, vividly coloured flowers. There may be a stream or a river in the background. And that's where sometimes they meet dead relatives or friends, or sometimes a being of light, usually associated with the person's culture. Sometimes they have a life review, and the life review really fascinates me quite a lot. Because with the life review, they can see everything that's ever happened to them in their life, the significant things and the insignificant things. But what is interesting is that sometimes they can experience this from a third-person perspective, so they can feel the impact that their actions have had on other people. See your love,